I'm Jan Gatehouse.
And I'm Sally Sidhu.
We are the infant feeding leads at Maidstone and Tunbridge Wells NHS Trust. We've made this short film to highlight the benefits of colostrum collection in the antenatal period. We hope this film will help mothers to understand the importance of antenatal colostrum collecting. We do know that breastfeeding can sometimes be a little bit challenging, particularly if there are twins or your baby arrives early. If we can predict these circumstances, there is something that we can do, and that is collecting colostrum in the late pregnancy, the last few weeks before the baby's born. Colostrum is the first milk that's produced in the breast from about 16 weeks of pregnancy. It's high in carbohydrates, protein and anti-infection, and low in fats. It's the perfect milk for babies when they're first born. It's also known as liquid gold. So Sal, let's think about who we'd suggest colostrum collecting to.
Antenatal colostrum collection is recommended for a mother who has diabetes, including gestational diabetes, a raised BMI, a multiple pregnancy, a breast abnormality or previous breast surgery, and also if she's taken medication during the pregnancy, like beta blockers for high blood pressure. Antenatal colostrum collection is recommended if a baby is at risk of prematurity, at risk of being small for gestational age, or has been diagnosed with something rare antenatally, for instance cleft lip or palate, or even Down syndrome. I'm now going to demonstrate how we would collect colostrum antenatally using a breast model. First of all, mother must be comfortable, warm and well fed and relaxed and well hydrated. We begin by gently massaging the breasts, and this is very gentle. Gently stroking the breasts. This is to get an oxytocic reaction. We can do little circles, whichever the mother prefers. Some people prefer this sort of an action.
Now let's see how this works in practice. Mums should have clean hands, short nails, and feel really nice and relaxed when they start their colostrum collecting. They should remember to have eaten well and drunk plenty, and try to focus on that lovely baby that you can feel moving in your tummy, as this will help to release your oxytocin, aiding baby's brain development. Okay Jane, do you think you've done enough? Probably. So would you like to show the C shape with your finger and thumb? Oh, Jane, just to remind you that you need to put your two fingertips with the soft bits, with the nipple between the two fingertips. That's perfect. Some women like to just run their fingers down from the top and feel the difference in sensation. Don't press too hard so you don't hurt your ducts, but whatever you feel more comfy with. But we usually say 2 to 3 centimeters back from the base of the nipple. We're going to press back towards the chest wall, almost as far as you can go really, without it being uncomfortable, and then you're going to compress together. Just gently and hold. Usually do this for about 4 to 5 seconds, just hold it and then release. But keep your fingers in the same place and do it again. Remembering that colostrum is a really thick, honey-like substance, fantastic for your baby, perfect food for baby. And then you'll start to see this little dewdrop of colostrum arriving on the nipple, and Jane's going to take a syringe and put the syringe tip underneath the drop and catch it in the syringe by pulling the plunger back. Some mums find this quite hard to do on their own, and will need a partner to help them, who also should have washed their hands and be quite happy to do it as well. So it might be a partner, a mum, a friend, a sister. And Jane's collecting this beautifully, with the colostrum coming nice and slowly to begin with, which you'd expect. And the more often you do this and the longer you do it, the colostrum can get a little bit easier to come. It will remain colostrum all the time you're hand expressing antenatally, and if you're doing this postnatally, it'll be like this for up to 3 days. Jane has completed the colostrum collection for the day. She's going to label her syringe by getting a white label, a sticky label, and attaching both ends with all her information on that little label, and bringing it together at the far end of the syringe so we can see the colostrum in the syringe. So the label has got her name, her date of birth, the day we've collected, and the time we've collected. And each syringe would look like that, hopefully, and you'd then put it into a container, which could be an old ice cream container that's been cleaned and washed, or a Tupperware, into the freezer with a lid, and make sure that you put a hospital label on the lid, and then with all the details of your colostrum safe, so that we would never get it muddled up with anybody else's for your baby, because your colostrum is completely unique to you and full of lots of fantastic anti-infection and lovely carbohydrates. It's going to give the baby lots of advantages when it's first born, if it were to be given the colostrum and it needed it and was unable to feed. We recommend hand expressing up to 3 times a day. If you only manage to collect a small amount at one session, you can keep that syringe in the fridge and add to it at the next attempt. No syringe should be kept in the fridge for longer than 24 hours if you're intending to freeze it. Should we put a little bit of colostrum on the end of your finger? Yeah, he's sucking nicely. We can put the syringe probably in down the side of his mouth now.
Okay, so shall we start?
Yeah.
Hi, so we're just going to show you how to administer the colostrum using finger feeding. And so baby's sucking nicely on mum's finger here. So we're just going to very gently sneak the colostrum syringe in the side of baby's mouth and just squeeze in tiny amounts at a time, so that he can suck and then we can hear him swallow, and we have the reassurance that he has actually swallowed it all. Well done, that's lovely, little one. You ready for some more? Oh yes, you are. Fantastic. Oh. We hope that this film has helped you understand the benefits of colostrum collection and how to do it. If you require any further information, please talk to your midwife or the infant feeding lead.
Thank you for watching, and good luck.